day, just another day. I pray soon as I woke. Never thought I'd be the victim of a paralyzing stroke. On that day, just another day. I pray soon as I woke. Never thought I'd be the victim of a paralyzing stroke. Stroke could be you. It happened to me. Never thought it could happen to me. On that day, just another day. I pray soon as I woke. Never thought I'd be the victim of a paralyzing stroke. On that day, just another day. I pray soon as I woke. Never thought I'd be the victim of a paralyzing stroke.
What's up, everybody? How you guys doing? Another episode of You're Too Young to Have a Stroke. We're in the middle of the month of October, and in the United States, October stands for AVM Awareness Month. So today is no different. This is the AVM Awareness Series for October, for the month of October, and we're doing it great. And this is our second episode that we're going to have tonight, and it's a pretty good episode. Before I introduce it, I want to introduce my friend, my good buddy, Christina Perez. How you doing, Christina?
What? I think you should take me off screen and do that over again. What?
Yeah, I love the dub on that one, but hey,
where's all the pizzazz?
I don't know, man. I just lost it. I saw your beautiful face in the backstage. I was like, wow, and got me all flustered.
Hey everyone, it's me, the energetic, bubbly, spicy, soft, and pathetic Christina. So good to see everyone. I gotta give my own introduction. And also Greg's friend.
But hey, Christina, this is AVM Awareness Month, and like last week we had Gina Keeley on here, and she was talking to us about her daughter that lost her life to her AVM. So she made up the Paige Keeley Foundation, and she's trying to bring awareness to this disgusting condition. But she was just talking about AVMs inside of the brain, and I was curious, can you get in other places in the body? And I was like, yeah, you probably can. And I found somebody that actually has a daughter that had it somewhere else in her body. It was inside of her spine, and she wanted to bring awareness to this. So I think we should actually bring this all together so she could actually tell our story. What do you think?
Absolutely.
All right, let's do it. So without any further ado, let me introduce our guest for tonight, Salina. How you doing, Salina? Salina Ramirez, right? Am I correct with that?
Yes.
Salina, how you doing tonight?
Good. How are you guys?
I'm well. I'm glad you didn't laugh at me at the introduction I gave on Christina.
No.
Like,
yeah, I was all over the place. I don't have my water. I hope
I don't do that.
I hear you. But Salina, you contacted me probably about 2 or 3 months ago, and you was asking me about spinal AVMs, and do I know anybody that has it? And you give me any information about it. I was like, I don't really know anything about it, but I would love for you to come onto our show to speak about it. So here we are today. So can you tell us why you're so adamant about getting information about this, and what is so important for you to understand spinal AVMs?
Well, normally you hear a lot about, whenever you do hear about AVMs, which is rare anyways, you hear about them in the brain. I have a special interest because my daughter, Ava, had a spinal AVM that ruptured when she was 10 years old. Oh. And I've been looking for support groups and, just different information about spinal AVMs, and there's not a whole lot out there. So I feel like it's my duty, my obligation as her mother to spread the awareness that AVMs can happen. It can happen to you, can happen to your child, God forbid, but it could happen to you, and they're devastating. It's basically a stroke within the spinal cord, and, they change your whole entire life.
So Christina and I have it in the same particular place in our brain. It was in the cerebellum, and, we have different types of deficits from it. what are the type of deficits that you can actually have from a spinal AVM?
Well, it depends on where it actually occurs within the spinal cord. Um, Ava has a thoracic, which means in the T spine. Um, and that basically affects everything below the thoracic area. So that's like basically from the waist down. She's completely affected. She's paraplegic. She has neurogenic bladder and bowel, which means, you know, it's difficult to control there. She has nerve pain now. Um, there's, you know, she got scoliosis after 10 months of being in the chair. And it was pretty severe. It was an 80-degree curve in her spine that developed just from being in the chair for 10 months. And by chair, I mean wheelchair, because obviously she lost the ability to walk. So it's pretty severe. I mean, um, I still have her with me, and I'm so thankful for that. She's still here. She's thriving. She's 14 now, but it's pretty devastating to a person and their family, of course.
Now, when you say that, Salina, um, Ava was 10 years old, you said, correct? When
Yes.
this happened? Could you know, did you know that anything was wrong? Were there any symptoms? Were you aware that she had an AVM or that something was medically going on prior to the
No,
rupture?
had no idea. With most kids, I guess, historically, we hear about growing pains, like when their legs hurt occasionally at night when they're laying in bed, or when their back hurts or something occasionally. But that's all I knew, was just here and there, sporadic, nothing regular, nothing like really reproducible. So there was no like black and white signs in front of my face to say that this is what was going on. Not that I knew anything about it anyway, but you know, I work in the healthcare field, um, and I definitely would have done something differently had I seen any indication that something was going wrong.
I hear that a lot when it comes to people in the medical field that has their loved ones have something like this happen to them. Like I don't understand this AVM spinal stuff, but you know, with the stroke that Christina and I have, a lot of people say, "Well, I never heard of an AVM before. I never knew that this can actually happen. I didn't know that could be congenital. I didn't know any of this stuff."
Mhm.
So with you and in your profession and also the people that's around you, did anybody know what this was all about when this actually happened to your daughter?
No, no one.
So how did that feel to you when you was just completely in the dark and you have your daughter here, you want to protect her, you want to do everything for her, and all of a sudden nobody has the answer. What did you actually do and how did you overcome those issues?
Well, when the actual rupture happened, she was thousands of miles away from me. We live in Florida, and she was in Ohio with her sister and my parents, going to see snow for the first time. So when it actually ruptured and I got the news, I was at work. And um, obviously, when something like that happens, you just lose um, the ability to do very much productive. I handed my credit card to my coworkers and I said, "Get me on the first plane to Ohio right now because I got to leave. Something's really wrong." So I got there that night and basically was just by her side nonstop from then on out. And um, talking to the doctors, I understood a lot of the medical terminology, but it was the first time ever in my entire life that I've ever heard of an arterial venous malformation. I never heard of that before in my life. Um, my field of expertise is cancer treatment. Um, you don't hear about these things in my field. So, and it wasn't a part of my education either at college. So I was lost. I was like constantly Googling. I was asking the doctor what I thought, you know, the best educated kind of questions could be, but it's desperation. You just don't know what to do. For her, it caused her extreme pain. So she was, by the time I got there, she was in such pain. It was unbelievable. And then, once they got her pain medication on board, it was like she was just completely drugged. It was awful to see your child like that. You know.
I'm trying to imagine it, but I can't, and I'm not trying to be mean about it. I'm just trying to get some understanding. Like for me, I know when I went through my rupture, I was very upset with people. My filter was gone. I did a lot of things to people that I regret that I did, you know, and the people around me, like my caregivers, couldn't comprehend what was going on with me. I couldn't explain myself to them. Did you have to go through that? And is there any type of counseling for the caregiver for this particular type of situation?
I did get some therapy, obviously. Mental health is something that also really suffers after something so devastating as an AVM rupture, anywhere you have it. Um, so that really did help. It helped Ava as well, but there's nothing specific or specialized to what we were going through that anyone could truly offer. Even when she was in the hospital, no one specialized in that kind of a thing like AVM ruptures in the spinal cord. No one specialized there. When we were air flighted back down to Florida, there was no AVM specialist here. So, it was treated as a spinal cord injury. And that's kind of how we proceeded through until we found the specialist in Miami that had obviously dealt with that before. And then we got more information finally through them.
Christine, this is blowing my mind. I like everything I'm hearing that Salina is telling me is like, I
It's
know
heavy.
it was difficult for us and to understand what's going on with us, but they weren't even categorizing her right. They was just categorizing her, something's wrong with her spine. She has a spine injury. This is what we're going to deal with. And she's not getting the proper information for her daughter to go on whatever her recovery is. What does that do for you? How does that make you feel, Christina?
It's heavy. Selena, it's really heavy. And it's very important that you had mentioned that you did your own research. You did your own research, which is very important. And I think on a caregiver aspect, having someone that's able to be cognitive enough to know that there's more, so therefore you need to research more, is very imperative, not only for Ava's recovery, but for your understanding and your mental health as well. So I commend you for, digging deeper. I know, of course, you're a mother, so you're going to do whatever you need to do to make
Mm-hmm.
sure that your baby girl is okay. And I know that I'm sure it was so difficult being on the other side where medical professionals are telling you this is how they're going to treat this, and then you knowing that you needed something a little bit extra.
Yeah. They're
And
telling me this is your new norm. Just get used to your
yeah,
new norm. And I'm like, what? If you can't tell me that her spinal cord is severed, then you can't tell me she's never going to walk again. Because they tried to talk to us like that she's never going to walk again. And I'm like, well, stop that kind of talk. You're not going to talk to her like that. And you're not going to talk to me like that because you don't know me and you don't know Ava. So we've been determined from that point on, she's going to recover. It's slow, but it's happening.
I'm smiling because it seems like every type of doctor, from neurologists to neurosurgeons to, I guess, people that's dealing with the spine, say the same exact thing. This person's not going to walk again. Like, you don't know that. And I'm glad you said that. Her
Yeah.
spine is not severed. So why would you say that she's not going to be able to walk again?
Mhm.
Don't put that negative energy into someone's space, so they can automatically just say, my life is over. I'm done. This is what I'm going to do. Be in a wheelchair the rest of my life. No, give them inspiration. And I don't think people realize how the medical field just deals with the symptom. They don't really deal with the person.
Yeah.
Once the symptom is over with, okay, we fix that. We stabilize it, move them on, because we could deal with our next patient. But now we have a person that has mental problems, trying to fit back into society, and they don't deal with it. They just send you home, and they don't give you really great reinforcement to do that. And it's unfortunate. And I'm sorry that you guys had to go through that as well.
Thank
Salina,
ahead,
sorry,
Christine.
Greg, did I cut you off?
No, you didn't. But I'm kind of used to it.
Good for you. You big boy, you. Salina, in reference to your family, you have other children?
Yeah, she has an older sister. She's 16 now.
Okay.
She was there when it all happened. Yeah, they were trying to take her to the emergency room from the hotel they were at, and she lost the ability to walk. So they put her in like an office chair with wheels, and were wheeling her out the hotel. And they had people in the hallways yelling at them, saying, "That's not what those chairs are for." They had no idea what was going on. But here is my Ava, getting carted off because she's in so much pain. And
nobody knows what's going on.
Yeah.
I don't mean to bring you through this, but unfortunately, I want people to get understanding of this, because whenever we speak about the AVM ruptures, we talk about, happening inside of your brain, and someone passes out, and, they have headaches, they get nauseous. Can you tell us what happened with Ava? What was her symptoms when she actually had it?
Yeah. Well, she had just arrived in Ohio with her grandparents and her older sister. They were traveling to get their rental car, and she started experiencing some back pain. And she didn't complain too much, but she told my mom, "Nana, my back hurts." So my mom was like, "It's okay. We'll go back to the hotel and we'll just get some rest." So they stopped for some hot chocolate, and then they got to the hotel, and they were starting to go upstairs to the hotel room, and she all of a sudden lost the ability. Well, she got weak in the legs, and she toppled back over. She was going up the steps, and she fell back. My mom kind of caught her there, and she was like, "Oh, whoa, what happened?" And Ava's like, my leg just stopped working, or my leg was tingly. I'm not sure exactly what was said, because everybody's mind goes kind of blank when these kind of things happen. So she made it up the stairs with some help walking, and they got to the hotel room. They lay down for a bit. In the middle of the night, she said she had to go to the bathroom. She tried to get up. She had to get help walking to the bathroom because she was in a lot of pain, and she couldn't get there herself. So my parents helped her get to the bathroom, said she had to pee, and she couldn't pee. They got her back in bed, got her comfortable as much as possible. I guess they fell asleep the next morning. It was just excruciating. So within a period of, I would say, 12 hours, or maybe a little more, within a period of 24 hours, she went from being able to walk, talk, do everything any typical kid does, to losing the ability to use her bladder. She lost feeling in one leg first, and then the other. And then it was just excruciating pain. So they took her to the emergency room. They actually had to do a catheterization to empty her bladder, because her bladder was so full and she couldn't empty it on her own. And when they had to transport her to a different hospital. And they did a scan, and they saw a mass in her spine, and they thought it was a tumor. But then they did an MRI, and that's when they found the AVM. And, you know, like I said, she was in such excruciating pain. The first thing they could do was just, I don't know if they gave her morphine or what, but, you know, she was pretty highly, highly medicated. And we actually had to wait for a specialist to, it was New Year's Eve. So a lot of doctors and specialists go on vacation. And of course, the one specialist we needed, which was a special radiologist to do an embolization, he was away. So we had to wait 7 days of her actively bleeding into her spinal cord before anything could be done, because there was so much swelling. And there was, the neurosurgeon there told me that, you know, I can't, it's too risky, can't do anything. We need this doctor, the specialist interventional radiologist, to come and do the embolization. And the wait was just horrific. She was drugged the entire time. She was barely able to, you know, she was able to speak, but it was just really, really not her, you know. It was horrible.
I'm lost for words here because
My face. I'm like,
I'm trying to keep you off camera because I can see your face. But you know,
I'm
I'm lost for words myself, Christina, and I'm hearing this. And Salina, you're right. This is completely different than what me and Christina went through. So we don't really have an understanding of how this is. So I hear you, and I hear what you're trying to do. But what is that you're trying to do with this? You know, this is AVM Awareness Month. What are you trying to make sure that people understand about spinal AVMs, and what is it called after it ruptures?
Well, it's called a spinal stroke, and people don't know about these things. People don't know that you can have a spinal stroke. It does happen in kids. Arteriovenous malformation is a word that I never heard before any of this. And I never knew that that could be possible to happen to one of my children. So I actually found out after the fact that she had been complaining at school during recess that her back hurt, and she would sit out every day at recess, and I never got a phone call. So that is a symptom when you have pretty bad back pain where it hurts to run, um, or leg pain or tingling in any way, shape, or form. It could be a sign of something pretty serious. So, you know, listen to your kids, keep good communication with your school, pay attention to your own body. If you feel pain or tingling that's not normal for you, go get it checked out. You know, I wish that I would have known, because things might have been different. You know, I am not shy about advocating for what I think is right. And I definitely would have pushed to have her examined by whoever could give me answers.
I don't know if you do or not, but I don't want you to start blaming yourself, because this information wasn't readily for you. Nobody knew about this stuff. So if you are, please do not go down that dark path and start blaming yourself and say you could have done things better. It just happened this way. You know, this is how life is. But I applaud you that you're taking this opportunity and the strength to actually teach other people about this, because that's what you was looking for in the first place when your daughter started asking about, mommy, I have pains, or people saying I have pains, and nobody understood what was going on about it. Now you putting this out there. Now I'm informed. Now if someone's telling me that they're having this pain in their lower spine, I'm thinking of that as well. So
Mhm.
I thank you for allowing us to hear your story, hear Ava's story, and being able to be strong enough to do it. I really applaud you. Thank you.
Thank you. I appreciate the opportunity. I've never really spoken like publicly like this before, and never really thought I could without crying.
You're
um, but
great.
I think it's important. It's really important that people know.
Selena, you're doing magnificent. And I know Ava would be very proud because you're not only just speaking for yourself, but you're speaking for her as well and for possibly other children or adults. You know, what you're
Yeah.
doing is huge. And I don't want to make light of that. It's huge. This is not easy, you know, especially knowing you're live and there's people watching you. Let's hope, you know,
Yeah.
something doesn't fall in the background and stuff. My thing, like I had said to you when we previously, is I I'm really into people's energy, and you actually had brought that up earlier, you know, about the doctors bringing up about her not walking. Um, with that being said, you speaking about you being a caretaker with cancer patients, how do you feel that your field prepared you for this?
Wow, that's a good question. Well, I know a lot about patient care, and I know a lot about the medical terminology and what certain things mean. And just knowing that, you know, the people that I cared for when I was treating patients, you know, every day, they're scared. They've never been through this before. They don't know what to do. So I think it helped. I wasn't afraid to put gloves on and do whatever. The doctors and the nurses taught me a lot about how to take care of her when she got home. She's since had several surgeries, and I've been right there with her the entire time, um, advocating for her, empowering her to use her own voice. When we go to doctor's appointments, when they look at me and they talk to me, I'm like, she's right there. Go talk, you know, talk to her. She's the one you want to know about, you know, don't ask me, ask her. So it's important that she have a voice and she have some control over some part of her life, which she's lost so much of already. So I just empower her as much as possible and stay positive as much as possible. And I've never, ever, ever lost faith or hope. And I know she's going to recover. It's going to take a long time, but she'll get there.
When you say recover, Salina,
Yeah.
can you clarify that for us? What does recovery look like for you, for her, in your eyes?
Well, the neurosurgeon told me that it takes uh, the nerves it takes a nerve 1 millimeter a day. It grows 1 millimeter a day. So it's been almost 4 years. And she's getting more and more sensation down below past her hips. She's able to flex her hip muscles, her quads. That's something that she's never been able to do before. She's feeling heat and cold, and that's something she's never been able to do before. So, you know, just gradually getting sensations and feelings and movements and muscle action, you know, getting all that back. And I would like to see her back on her feet. I think that would be, you know, the ideal recovery. Even she's like, I would be happy even if I walk with a limp. um, but I'm happy as long as she's happy. And so we're doing everything we possibly can to keep her on that road to recovery.
Christina, we got some comments from the peanut gallery, so let's see what we have.
Oh, that's right. I forgot. Salina, you got me wrapped up, boo. I'm waiting for Greg to start reading. I forgot. That's my thing. So, Salina, I'm sure this is pertaining to you. So, if an ambulance was called with complaints of back pains and the patient was taken to the hospital, how could they be aware of spinal AVM?
The only way they really can know is if they do scans. And by scans, I mean like an MRI, CT scan, I believe that's what they did on Ava. Initially, it was a CT scan. That's when they saw a mass. When they did the MRI, that's when they actually saw the actual AVM. That's when they changed the diagnosis. So MRI is really important.
But I think the question is more pointing to like if the paramedics come, how can you actually articulate to them like, hey, I think this is a AVM spinal rupture. Like, how would they actually know that? How would you know that? How would a person know that this is the problem that they have before they get to the hospital?
Oh, the only thing I could say to that would be is if they were having numbness and tingling down one of their legs, or pain in their lower back, or numbness, tingling in their back, and extreme pain. Those are the signs. And leg weakness, if they can't actually stand up and walk. Those are the typical symptoms that I saw that Ava had.
Christine, we have another question.
How could they alert the hospital that this is more than just a normal back pain issue?
I just hope that somebody's with you that can advocate, because if it were me with you and you were having those issues, I would be loud and clear that you need to scan this person. They're going to take their time. ERs are notorious for taking their time. Nothing against ER, family out there. Sorry. But, they take their time. They assess. They do all the, tests and everything. But, I would just be advocating loudly and clearly that they need to get the person scanned, get some imaging.
This person that's keep on asking these questions is she was a captain or is a captain of paramedics. So she's asking these type of questions because she wants to be able to help out when something like this happens. So it might seem like she's just asking random questions, but she's really asking because she's trying to bring more awareness to it herself. So here's another question that she having.
If it was early, meaning there was no limb weakness.
I guess that's the continuation of the question. Like if there was no limb weakness and like what was happening with us with Ava, that you said that she was just couldn't walk, things was just happening in a certain way, but she still had feelings in her leg. How would you be able to tell at that point that boom, she still has feelings in her leg, there's no numbness or anything like that, but she having problems walking? What should you do? Like, should you just automatically just go right then and there, or should you wait and see if things just change up? I think that's the question that she's asking.
I wouldn't wait, knowing what I know now. There's no way. There's no chance I would wait. I would suggest it to the hospital. That's the only thing I can think of. Suggest, maybe this could be an AVM in the spine. But everybody's different. And I don't know anybody else that's had a spinal AVM. That's what I was looking for, Greg, when I came to you, is to see if you had anybody else on your show that was talking about spinal AVMs, because you don't really hear these stories ever. So all I know is what my daughter went through, and it was numbness, tingling, and then just weakness and extreme pain. Those are the only things that I know of that, that were happening to her. And then the fact that she couldn't empty her bladder also, that was another thing.
Now, Salina, I have a question. You had mentioned earlier that they categorize it as a spinal stroke.
Yeah.
With that being said, did Ava experience anything similar to, I know, I don't know if you watched any of the previous shows, but the majority of the time when Greg and I speak about going through the stroke, vomiting, I don't believe that I lost bowels. Did you, Greg? I recall vomiting.
Lose what?
Your
Bowel.
No.
Vomiting was a huge thing. Did Ava experience any of those type of symptoms that essentially kind of parallel to having a stroke with people?
No, no. I'm thinking that the symptoms for spinal AVM are completely different from something in your brain, having an AVM in your brain or a stroke in your brain. She didn't have any of that. She didn't have any headaches. She didn't have any dizziness. Nothing like that. No nausea.
There's
It was
something
just,
that you're saying, and I want you to really drill home. Gina was doing the same thing in the last show. She lost her daughter to an AVM in the brain. But you're saying something like, I wouldn't wait. I will
yeah,
go to the hospital. If something like this comes up, there's no such thing as waiting. Just go immediately. There is people out there that are like, oh, you know what? It's just a little back pain, or I got a little headache, or is this a little numbness in my feet? It'll go away. My foot fell asleep. What do you say to that? Do you tell people, advocate for this, move forward, go, even if you're wrong, you'd rather be wrong than right,
exactly. I belong to a bunch of different spinal cord injury groups on Facebook, and also some AVM groups on Facebook. I've there's been such a thirst for knowledge and community since this whole thing happened, and there's mothers out there that are talking about their kids having the same feelings that and symptoms that Ava had when she was, before her rupture. And I am the first one to pop on there and be like, take him to the hospital right away. Don't waste any time. Don't wait for, 3 weeks to go see the specialist. Do it now. I'm trying to prevent something like this from happening to somebody else.
I'm gonna play
And I
devil's
think we say
advocate with you.
the same thing. Oh,
Go
look,
ahead.
I cut Greg off again.
No,
You'll
go
be
ahead.
all
Go
right.
ahead. Go ahead.
I think we say the same thing in reference to us. Obviously, with our brain, you mentioned about not waiting. I know for myself, with the symptoms I was experiencing, I did go. I went to my primary doctor first, all in a week span. And then from my primary doctor, I drove myself to the emergency room
I still
because
can't believe that.
I felt like something
That's
was
crazy.
off. It wasn't normal. And I went through the whole stages of like notifying people, like, listen, something's not right. It was different. And it broke my heart to hear. We were backstage, so you couldn't see us, but when you said that you heard after everything that Ava had been going to the nurse's office and sitting out during recess, and nobody paid attention to that. I think that's something that should absolutely be repeated again. Um, I recall, being in grade school, and you think about, kids not feeling well or things of that sort. And if it's something that they consistently do, whether it's behavioral, which is usually what people jump to, right? Right away. It's behavioral. They don't like school or something's going on at home. Um, but nobody notifying you, you know, and then hearing about it afterwards, just for something for parents, like if your kids are saying something's wrong, you have to listen and pay attention. Pay attention, listen, and it's a lot easier, to go and get them checked out and figure out something's wrong and then go move on to the next thing than it is in a situation like um, you unfortunately had to go through with Ava. And I'm glad that you brought that up, that you did hear from the school that Ava had been complaining about back pain and was sitting out and things of that sort.
Mm-hmm.
Yeah.
Salina, I get this sense. I'm not sure if it happens to you, but I know I was getting a sense from our last guest that people think that she's paranoid. She keeps on saying, "Hey, don't wait. Take your child to the hospital. If something's not right, like for the AVM in the brain, if they have an extreme headache, don't brush it off. Automatically go to the hospital." Do you get that from people that they think you're paranoid because every time something comes up, you say something like that?
No, never. No, anybody that knows us as a family or knows Ava, uh, what? Oh, Ava thinks I'm paranoid. She says that, but she's the only one that says that. But you know, anyone that knows us and knows what she's been through, um, I don't think anyone would dare say that because you know we've been through so much. She's been through so much. Um, you know, I don't want to leave anything to chance. And working in the healthcare field, you're already paranoid. You know, um, I started getting, uh, you know, my own self checked out way before, you know, the milestones that you're supposed to, like with the mammograms and the chest x-rays and, you know, things like that. So I've always been proactive. Um, I don't think it's paranoia. I just think it's being proactive. And it's, like you said, Christina, it's easier to get somebody checked out before, you know, before what happened to any of you guys, you know, any of you guys, including Ava.
We got some more comments or questions, so I'm gonna play them out for you guys.
Miss Dolores, sweetie, God bless you and thank you for sharing your story.
Absolutely. Thank you.
And Miss Carissa states, Salina, keep holding on to your strong will to keep pushing forward for you and your daughter. I love your strength. I'll keep you and your daughter as well as your family in my prayers.
Thank you. That's very sweet.
Destiny states, do you think if you had more information from the school about her pain, you would have been able to catch her symptoms?
I most definitely do. I most definitely do. I would have not waited for anything. I would have had her checked out. And unless someone could give me a solid answer, this is, you know, that satisfied me or made her feel better, I wouldn't have stopped until I figured it out.
Now, have you been in contact with the school in reference to, I'm sure you have, what essentially happened to Ava? And is there anything in the works as far as them understanding that with what was having previously for something for them to look out for or anything?
I did. I was pretty upset, pretty angry with all of it. I think that's pretty understandable for what happened. But I did send an email. I couldn't really speak in person about it at that point. Um, but I did send an email letting them know exactly what happened to her and that what she had experienced was a symptom and they should have called me. I needed to have a phone call. You know, both my daughters went to that school all their life and I they have my phone number, they have my information. I was there for all kinds of events. There's no reason they should not have called me and let me know that something was going on with her. That's unusual behavior. You know, what kid sits by herself or complains about paying during recess on a regular basis? I just couldn't believe, you know, kids don't communicate their feelings the best either. So, you know, we weren't hearing this on a daily from Ava. Um, but, you know, she's a kid. These are adults and they should have notified me or her dad.
That's where I have the problem at. You know, you're dealing with a child and you don't know if a child is telling you the truth. How can you actually articulate that? Because you're not going to see any signs on their skin that anything is wrong. It's all internal. So what advice do you have for, you know, a parent that's dealing with an adolescent that's complaining like that, and maybe they've been crying wolf for the last 2 or 3 years, and now all of a sudden this is serious? Like, how do you actually tackle that? You balance that. How do you balance that? I don't understand. Like, can you explain that to me as an adult, as a father dealing with children? How can a person handle that?
First, I would say try to listen to your kid. Trust what they're saying. If they're complaining about something that is extremely painful or troublesome to them, take them to the ER. Nobody wants to be to the ER. Every ER visit is at least 4 to 6 hours in the waiting room. It's not a fun time. They get poked with needles. They get, so chances are, if they're lying, they're not going to want to go through that again. They're only going to want to fess up if it's actually the truth. If they're really desperate and in pain, or something's wrong, that's, if they've already been to the ER, they know what that's like. They're not going to say anything unless something's truly wrong. That's my opinion.
Okay. So basically, even if they are a person that cries wolf, you still have to be able to I can't even talk today. You got to decide the difference between the two of, if this person is fibbing or is this person telling the truth. And you just got to take that risk. And no matter what happens, if it's going to cost you an arm and a leg, maybe you don't have insurance, whatever, you still got to take that chance, because you never know, the outcome could be paralyzed or even death.
Yeah. We took my older daughter to the ER one time because she was having some sort of fit when we brought Ava home from the hospital. It was pretty ridiculous. But we took her to the ER because she was screaming. And by the time we got there, she calmed down. And my husband was like, wow, that was one expensive ice pop, because they gave her an ice pop there. But, like, when you're parents, you don't have like a guidebook. You don't have like, there's no rules. There's no like somebody to walk you through it. So you just have to use your best judgment and do the best you can.
And what I have realized, Salina, is that with a child, even if they're lying and the parent believe them, the child automatically has a trust. It's like, my parent believes me. So if I do have another scenario that is true, I know I could go to them instead of hiding things from them. So
Yeah.
I get that.
Yeah.
I really do.
Selena,
we got some more stuff. We got some more stuff, Christina. Do you want to talk?
I have more stuff. Selena,
Go ahead.
how has this changed? You mentioned that Ava has an older sister. How has this changed the family dynamic?
Oh, let's see. Well, her older sister is really involved in sports, and active social life. So she's on the go all the time. Ava she's in high school also. She's also really involved in a lot of things too, plus her activity-based physical therapy at NeuroFit. So we're always on the go all the time. It's been hard on the family, obviously, from the beginning, but I think we've all adapted pretty well. Her dad and I are just solid teamwork. If I'm away, he's, 100% caregiver role. When he's away, I'm the same. And when we're both here, we just, tackle it together and do whatever we can to keep the family going. But we're all doing well.
Good for you. We have a question.
Yes, Christina. Can I go to the questions now?
You may.
Okay. Here we go.
Greg, you should read that. Who's that?
I can't pronounce her name properly.
That's unfortunate. Her name is
Aida Holmes.
Saida. What a story. I applaud you, Selena, this is to you. I applaud you for standing your ground to ensure that your daughter received the proper treatment. Your story shows me that AVM can happen to anyone at any time and at any age.
It's true. Thank you.
Yolanda said, thank you for sharing. Donna said, hey, you all, thanks so much for sharing your story. Kind of scary with Gregory and Christina. What are some of the symptoms you guys had? I'll start. As far as my symptoms, my blood pressure was through the roof for a week. It was very difficult to sleep. I had a lot of pressure behind my eyes, and I believe that's essentially why I honestly felt like my eyes were about to come out of my head, out of my skull. I had mentioned earlier in the show that I went and saw my primary doctor. And actually, what happened when I went to go see my primary doctor, she unfortunately was going through cancer and she actually passed. So there was somebody in there, I guess, in her place who's never seen me before ever, obviously just kind of was reading through a chart in reference to me. So I'm sure things probably would have been different if it was my actual primary care doctor. Then 2 days later, I drove myself to the emergency room because this pressure was wild. And then when the rupture happened, I vomited it. I started vomiting. Um, and then I kind of blacked out. Yeah. Fell down some stairs and then blacked out. I do recall saying, call 911, I'm dying. That is honestly the last thing I remember until like a month later. Those were my last words. And we have a comment. Oh, no, that's the same comment. Greg, you? And I know your story is different. You were actually driving when it happened. I was in a house.
Yeah, I was driving, but I know that this condition is something that we are conceived with. So throughout my life, I know there were certain things that was happening to me. When I was younger, my mom told me I used to have seizures, and when she used to take me to the doctor, they were saying, "Well, he looks healthy, he looks good. There's nothing that we should do. We shouldn't examine further." So no MRI, no CAT scans was done for me. Uh, I just know throughout my life, there's been times I couldn't speak properly, or I thought I was speaking properly, and the words wasn't coming out correctly. I still have those problems today. But when it actually ruptured, or when I felt that it ruptured, um, I had a excruciating headache. It felt like someone had a jackhammer in my head, or just a hammer just pounding in my head constantly. And I was trying to alleviate the issue with drinking water, and that didn't alleviate the issue. Um, and that was basically only symptom that I had was a massive headache. I had a friend that had a aneurysm rupture, and he survived it, and he told me how excruciating the pain was. So that's how I knew something was wrong with me. I thought I was having an aneurysm rupture as well. So that's why I took it so seriously. But if I didn't have my friend that told me this information about what an aneurysm rupture felt like, I probably would have ignored it and kept on driving. So that's my story. We have some more questions, and I think there's more tailored to Salina. So here we go.
As a caregiver, what are some of your self-care practices?
Going to get a pedicure or going to get a massage, something for myself, taking a walk, going to the gym. Those are the kind of things that I do. My mom started me going to the gym every single day with her. So that's really, really good. But of course, the other things really nice too.
What do you say to people that don't do those things? They feel guilty if they leave their patient per se. I have a lot of people that won't take care of themselves at all. What do you say to those type of people, and what is needed from them, as what your experience from your experience as dealing with Ava?
It took me a long time to get to this point. There was quite a bit of time that either myself or my husband were afraid to leave the house. We didn't want to leave her. We didn't want to run to the store unless the other one was home. I mean, it's definitely it's a big fear thing. But as Ava got older and more independent, it's much easier. It gets easier. Hopefully, I hope for everybody it gets easier, because that's what happened, with us and our family. It did get easier.
Salina, I have a question. One thing that Greg and I speak about not only on this podcast, but also on our You're Too Young to Have a Stroke Facebook group and things that sort, is referencing this rebirth, we call it, where when you go through this type of experience, you're reborn. And you being Ava's mother, who is this new Ava? Or to you, I love your smile. Who is this? See, I'm digging. I knew it. Who is this new Ava to you? Or is it still your baby Ava that you?
Oh, she's always going to be my baby. That never changes. But she's a little badass. I hope I can say that on here. She's a little badass. She's very wants to be independent, doesn't need for anyone to do anything. With a child with disabilities, you have certain accommodations at school. She knows that, but when they try to, ask her, do you need anything at the school? Do you need anything? She's like, nope, I'm good. Nope, I'm good. And she's good, like advocating for herself with adults now, because we spend so much time at doctor's offices telling her to like speak up for yourself. Doctor, talk to her, not to me. She's an independent little badass.
Same question for you, because our situation's a little different in the sense that we were adults when we went through what we went through. So we're channeling through this new rebirth. Mm-hmm. Do you feel yourself as a mother that you had a rebirth, or?
I wouldn't characterize it as that. I think it definitely makes you reprioritize. It makes you realize that the stuff that you used to maybe complain about, or maybe things that used to bother you, are just stupid. They're not important. And do you want to pop on, Ava? Okay, she's right here with me. They're just not important. And it makes you just realize, don't sweat the small stuff, because, look what you just went through. Look what your child just went through. Your child needs you, and you just got to be as strong as possible. And that's what I do my best to do.
I love that. Do you need a moment for you and Ava to get together?
Does she want to come on? Does Ava want to come on?
I think she does.
Please, she can come on.
Ava?
Hi.
Hello.
Hi.
Hey.
Hi.
Ava, thank you for sharing your mommy with us tonight. She's doing great. She's been speaking so highly of you.
I've been watching her.
She's doing good, right?
Mm-hmm.
Ava,
go ahead, Greg.
Yeah, because Christina's hogging up the whole show. I wanted to talk to you too, okay?
Mm-hmm.
Gosh. Ava, can I really be frank with you? And I need to let you know, because I don't know if you know that or not. What you have gone through, not a lot of people can go through. So the strength that you have, and you being able to actually come on this camera and to speak with us, speaks volumes. You are a hero, you are a warrior, and everything that you want in life you can get. Don't doubt it. You'll get it. Just go for it.
Thank you.
All right. We love you, sister.
Me too.
And your mama too. Your mama.
And your mama. We love her too.
Your mom told us that you're kind of a kick-ass girl, huh? You like to handle things yourself?
Definitely.
That's
I try to
great.
be as independent as possible because it really did like affect me a lot not being able to be independent. Like mentally, it made me feel kind of like I just couldn't do anything for myself. So that's something that's really important to me now, being very independent.
I like that. You know, before this happened to you, was you that quote unquote kick ass type of girl, or are you just something that now you don't play around with people? You want things done a certain type of way, and
um
this is how you are?
I think I what do you think, Mom?
I think you were a lot more timid and mild before, and now you just don't hold back.
I guess so, yeah. I was a lot more timid and like kind of people pleasing before, and I'm definitely the opposite of that now.
I have one question, and I'm gonna let Christina go with it because she's out to dance and do all her thing.
Because I love these words. She's so articulate. You hear that energy? Ava, when's your birthday?
August 2nd.
Leo.
I'm a Leo. Yeah.
That's why. She's a Leo. She's
All
a
right.
lioness.
So, as an AVM rupture survivor, and people that's watching this and they looking at you and they say they're getting inspired to do whatever they need to do in life, what do you say to people that complain about everything in life and don't do whatever they need to do to the best of their ability? They always have an excuse. What kind of advice do you have for them?
I mean, I definitely think that the things, like the small things that you go through, you kind of, when you don't go through these drastic things, you kind of take things for granted, like a lot. Like when I wasn't paralyzed, I used to skateboard and I used to go on runs and like play sports and everything, and I thought that was just like that's just what normal kids do. And after this, I realized that I love doing all that stuff, but I definitely took it for granted. And I could have appreciated it more than I did. So even like the small things, like a lot of people can't shower by themselves or like use the bathroom by themselves. Like even those small little things that you do in your daily life, you should appreciate them because a lot of other people can't do those things.
See, Christina, I like her. That's how I think. I don't care what everybody else thinks, what everybody else want. I'm gonna do what I'm gonna do. I'm not gonna stress the little things. I'm going for it. She's saying the same exact thing. Not the same
You're
exact
not going
word.
to stress the little things, Greg. You are the little things that stress me out.
Oh,
Anyway,
that just went left.
as it should. Ava, I love how articulate you are. I love how very connected to yourself you are. I think it's so beautiful. And I think that you really need to internalize that. And I'm so honored, not only for you again sharing your mom with us, but you sharing yourself and your spirit. And you are a kick-ass girl. And you're gonna be a kick-ass woman.
Thank you.
And we love it. I love it. And this is just wonderful. And I just love the way you speak. I
Me
feel
too.
it. You really mean it. And that's really important. The difference between saying things and being those things is huge. And I felt that when you said that. Your mother kind of tapped into it a little bit, but you were right on the spot because that's how Greg likes to do people. He likes to put us on the spot. And you meant that. And I thank you for being able to bring light to that. With that being said, Miss Ava Kick-Ass Girl, what's your favorite thing to do?
Right now, I mean, I think probably spend time with my friends. My friend group, like go to the promenade after school, just like have fun with them and go shopping and stuff. That's probably my favorite thing to do at the moment.
Shopping.
Yeah.
We all love shopping.
Oh, but don't get her distracted now. Ava, what did you just do? But hey, we got some more comments. So, Christina.
Ava, I get to read these nice comments. Miss Donna said, Ava, this is towards you, honey. You are an inspiration. I pray you will walk sooner than later.
Thank you. I'm working on it. So I'm getting there.
Miss Yolanda said, Ava is awesome. We knew that she's kick ass. We knew before she got on screen. It gets better every day.
That's very true. I think in the beginning it was very tough mentally. I mean, obviously physically, but also mentally. It took a very big toll on me because it was such a drastic change at such a young age. And I thought it would never get better for like years. I thought that was just something that people just said to make you feel better. But it definitely does. Like it takes time. It definitely takes time, and you have to be patient. But it definitely gets better.
I'm so sorry, Salina. I know we just took over and just took your daughter and made her the star of the show. But I see something, and I'm very curious. So I have to ask this question. I know when people have a stroke, a brain stroke, they see life completely different. It's like we don't care for the things in life that we used to care for before, all those vain stuff. It's like I don't know how Christina feels, but I personally feel sorry for people that don't know how precious life is.
Mm-hmm.
And they wasted their time on stupid things. So I am curious for you, do you see it the same exact way? And are you totally different from everybody around you and you're trying to bring them to that place where you are and you find it difficult? Can you articulate that for us?
I definitely think,
Are you the mama bear of the group?
Yeah, I definitely am.
Yeah.
I definitely am. I make sure everybody's fed, everything. But I definitely do try to make sure people like don't take things for granted, because I don't like to like invalidate people's feelings, and I always listen and everything. But it definitely could be worse. That's what I try to say. Like it could always be worse, and don't take the small things that you can do now for granted, because even though you don't realize those small things, it's not small. Like they're very big things, at least to me.
And you said you're
Like
14?
Yeah, I'm 14.
Gosh, you're so mature.
Yeah, I just can't. You have to, well, I mean, obviously Greg's a lot older than I am, but I'm saying, and to me as an adult, you're a little seasoned, Ava. You're a little seasoned. With us being adults, right? Hearing you speak and the things that you're saying, there's adults that are still trying to grasp what you're saying. I promise you there is. Hence, I said you are a kick-ass girl and you're gonna be a kick-ass woman because you already have the mentality. Like the fact that you're just, my mind is blown.
Thank you.
Yeah.
Ava, is there anything that you want to leave for this audience so they can understand what your life is like, what you're actually preparing for yourself, and what you're becoming, like anything that you want to leave for us?
Definitely don't take things for granted, and everything gets better. Like it seems like it doesn't, and it takes time, but it definitely gets better.
Okay. We have another comment.
Carissa said, Ava, whatever you do, stay away. Oh, hold on. Let me switch up my tone because we're trying to put emphasis on this because there's exclamation points. Ava, whatever you do, stay away from them boys.
Oh, boy.
Stay strong, Ava. Stay away from them.
Did you hear her dad in the background? Yep.
Like, yeah.
I'm saying the same thing too.
Greg's saying the same thing because Greg has daughters, so he was.
I don't play that at all.
I agree. Teenage boys are definitely very stupid. So I try to stay away from them.
Jeez. So I know I said I had one question, but I have another one. It was hard for me to find people that understood what I was going through. I went to stroke survivor groups, but there was like people 60, 70 years old. I couldn't relate. Do you have that same problem now as a 14-year-old dealing with this stuff? Or when you was 10 and you was dealing with this stuff? Did you have any problems with that? And how did you get over it if you did?
I mean, when I was 10, I definitely had a problem with it because obviously like all my friends were they weren't in a wheelchair. They were completely mobile and able, and they just didn't understand what was happening to me and why I was in a wheelchair and stuff. And actually I lost friends from that because they just like couldn't process what happened to me. So they just stopped being my friend. So it was very difficult to find people who definitely understood who or like what I'm going through. And I've joined groups before and everything. It's just not the same. I feel like I have to connect with somebody on a personal level for them to like fully understand. And I've definitely found my group of friends who understand me.
Ava, around these parts, on your turn to have a stroke, we call that your tribe. That's your tribe.
Yeah.
Because a tribe, right? You're familiar. A tribe, there's always somebody for something. You have the people who make things, the builders, the cookers, and the one who goes and gets food. That's your tribe. And for you to be so in tune with that at 14, Ava, what is going on? I am just good for you.
Thank
I
you.
love that for you. I love that for you. And as you get older and more in tune with yourself, you're really going to tap into that. You are really something serious, my love. And I'm so glad that you're sharing your story and your spirit with us and your energy. But you're something serious. I don't even know. I'm
We
gonna
got some
stop
more
watching.
information coming in.
Destiny said, Ava, another friend. See, Ava, everyone's feeling you already. I knew it. Ava, you are a true testament to having a strong faith. Thank you for sharing yourself and your enthusiasm with us.
Oh, thank you. That's so sweet.
An absolute and a grant. Absolute and a grant. Ava, I have a question. How do you feel, if you can kind of remember from when you were 10 to now? Has there ever been a time where you felt like a burden to your
Oh,
family?
yes. There has definitely been a time where I felt like a burden to my family. Just because like I have an older sister. She's always been kind of like I feel like I just like started to take up too much time. Like because of my disability, people had to pay extra attention to me and spend more time with me, and I kind of felt like my sister didn't get enough attention. And like even with like kind of like money stuff, like I would worry if my hospital bills were too expensive and stuff like that, and that's something that a 10-year-old should not have to be worrying about. But I did, and I definitely felt like a burden for um having to like just like having to take up too much time and stuff like that. There has been a time where I felt like a burden, but you always find your place.
And how have you found your place? What
um
what what do you do to make you feel to understand that you are not a burden and the things that are being done for you are because these people around you love you and care about you?
Well, my family vocalize it a lot. They say how much they love me. They show how much they love me with their actions. My friends accommodate to me. My family accommodate to me. It just like they. I think thought in the beginning that I was just like a burden and nobody really cared that much. And now I definitely think that I'm obviously not a burden and that these people are doing these things for me because they love me, not because they have to.
I get it.
Yep.
Christina, we got some more comments.
Miss Dolores Graham, well done, Ava. You're beautiful and well grounded. I'm going to repeat that because I really want you to understand that. You are beautiful and very much well grounded. Good job, mom and dad. My hat off to this family. Miss Salina, Mr. Salina, I don't know if you can hear me. Absolutely. We're giving you your flowers, honey. However, Papa and Mama made you and raised you. So this beautiful gift of you that we get, they obviously watered you and nurtured you, and they've done an amazing job. You are you're really a breath of fresh air.
Thank you. Thank
You're
you.
the cool girl. You're the cool girl of the group. You're cooler than Greg, obviously.
Well, obviously, Greg is not a girl, so you definitely the cool girl in the group. You're the cool girl in the group. There's only two girls in this group, and you're the cool one.
Thank you.
You're so welcome. I thank you for coming on and teaching us about the maturity of a person, of a soul, because I think a lot of times people look at younger people and they don't think they could be mature, they could really understand what's going on in life. And you are proof positive that you can. You just have to be patient enough to listen. And a lot of times people don't listen to us or to children because they think they don't understand life. And it seems like you've been through so much in life so far that people can't even imagine. And for you to come out and actually be able to address the audience about this stuff is unbelievable to me. You know, I am blown away. Salina didn't tell us. She didn't tell us half of who you are. She was holding you back. Yeah, she was holding you back for real. That was her secret weapon.
She said, "Ava's a kick-ass girl."
That's all she said.
She's kick-ass, and then Ava comes on.
I am.
Let's go. You know, like, what? Salina? No, ma'am. You did not. Yeah, she didn't prepare us. But honestly, I'm glad she didn't. This is your time to shine. It's also your mom's time to shine. And I will tell you, you both absolutely are shining. And what a beautiful time to be able to shine during AVM awareness. And so grateful and thankful that with what you went through, you're here to be able to do just that and shine. You know, last week we had somebody on the show who unfortunately, you know, lost her daughter because of it and brought amazing awareness, Miss Gina. But to see this other retrospect, I'm very grateful and I'm very humbled by your mother and your story. And thank you.
Thank you.
Yeah, definitely.
So, Christina, it seems like we're getting towards the end of our show, and
Leave me alone. You don't hear me? I was just in all my feels.
I know. I had to draw you back in. Before you started crying.
What do you want?
Well, I just want to talk about who we're going to bring on next week, and I want you guys to close out the show so we can actually get some information about spinal AVMs and what we can do to bring more awareness to this. So, first of all, next week we're going to have another AVM survivor on our show. Next week will be part 3 of this series. This is going to be a brain rupture survivor. Her name is Cassidy Ewert, and she's going to be talking about her life and how she actually survived her AVM rupture and being a mother. But I'm gonna allow you, Christina, to finish us off so we can say goodnight to these beautiful ladies.
Well, I'm not going to finish off. I am going to say thank you, everyone, for watching. And for anyone who goes back and watches, I hope that you do take the time to do so, having Salina and Ava on today, and how informative and the beautiful energy that was brought on during this live. I am so very grateful. Of course, you can always go back and watch these on You're Too Young to Have a Stroke on Facebook and YouTube. We also have the Instagram, You're Too Young to Have a Stroke. And I'm sure people have questions. So I want this opportunity for Salina with what they've kind of been, informing us about as far as the family dynamics changing and things that they needed to do to ensure that Ava is a kick-ass girl that she is right now. Salina, I think this is an imperative time for you to share with the audience of where and how and what type of resources are out there that could essentially assist them to be a kick-ass mom to a kick-ass child. Salina?
Well, there's a few places that really helped us out along the journey here. The Brain and Spinal Cord Institute. Actually, we're going to start with Advocacy Network on Disabilities. They provide mental health therapy, counseling. They actually come to the house. They're amazing. Amazing. We've been with them for like 2 years now. They speak to both Ava, myself, and anyone in our family. I definitely say, reach out if you want mental health counseling. It's very, very, very important. They're good people. They make a big difference. And then this one is Chariots of Love. They were amazing. When insurance typically only approves a new wheelchair every 5 years. So when we ran into that big growth spurt from 10 to 14, Ava obviously needed a new wheelchair and insurance wouldn't cover it. So they were gracious enough to present her with a brand new custom wheelchair. So Chariots of Love was a very gracious donation with that brand new chair for her. The Florida Department of Health, they have a program called the Brain and Spinal Cord Injury Program of Florida. There's a beautiful woman named Paris. She walked us through, and she was able to get us services from occupational therapy, physical therapy. They even helped adapt our house a little bit with the front. We have a ramp entrance now, so it's a lot easier to get in our house. So they provide really amazing resources, and they're just good people too. And then NeuroFit 360, this place is amazing. Ava goes to physical therapy, and it's not just physical therapy, it's activity-based physical therapy. And for anyone that knows, anyone with a spinal cord injury, period, or stroke, they are amazing people. There's never just one person with her. She's there with at least 2 to 3 people with her, helping her, motivating her, cheering her on. She loves going there. It's hard work. She's there 3 times a week and for an hour each time. But they're amazing people and they do great things. She's gained a lot back after going there every single week.
Love it. Thank you so much for sharing, Salina. Greg, thank you for putting on the actual websites for anyone that wants to go back and reach that. Very informative.
You're welcome. Salina, Ava, thank you so much. You guys have a great night. Christina, as always, you've been the best person on the show sometimes. Maybe
now this is all Ava's show, honey.
Yeah, Ava did steal the show tonight.
Salina, it was you until you brought Ava on, baby.
I
Yeah,
know.
I'm
That's
glad
right.
you did because we had to put Christina back in her place.
You did good, Miss Salina. You are a force to be reckoned with. And just like I told Miss Gina last week, I love that for these past 2 episodes that we've had mothers on. You guys bring such a different type of energy and determination that all of us are here on this earth. Greg, you didn't have to put me on the big screen. All of us are here on this earth because of our mothers. And to be able to hear these 2 stories from such strong women. Today, we got an extra special treat to actually be able to speak to Ava. It's beautiful, and I commend you for it. And you are an amazing mother, and Ava is very, very fortunate to have you. Miss Ava. Okay, Greg, you can get off of me now. Miss Ava, get out of my face. I'm shiny already. It's 9:30. My makeup's wearing off. I don't look like you, Greg. Miss Ava, my kick-ass girl. You are so beautiful.
Thank
Your
you.
soul is beautiful. And thank you so much for, again, sharing your mommy with us.
Of
And
course.
more importantly, sharing your story with us. And I'm sure Greg has something to say to you as well.
I really don't have anything to say. Everything I said has been said, and I can see through you that you're going to do some amazing things in your life. But I do have a request for you. Can you please close out our show, tell our audience goodbye, and leave them any inspirational quotes?
Of course. Well, I hope you enjoyed. I thank you for listening to my story. And it always gets better, no matter how long it takes, it does. Yeah.
AVM awareness.
AVM Awareness Month.
Bye, everybody. Have a good night.
Bye, Ava.
Bye.
Miss Salina, bye, honey.